Okay, folks, I know somebody that has an issue with, they suffer with the gluten allergy, and it really causes some dietary nightmares. Well, recently, they've also been diagnosed with adult onset diabetes. Now, we know that this is self caused virtually all the time. So he asked me to look into it a little bit, so I did. Now, one of the issues is gluten containing foods are quite often high in carbohydrates, and anybody trying to regulate or control their blood sugar levels know that carbohydrates can really be an issue, especially the empty carbs. Your soda pops, your Twinkies, things like that are nothing but a sugar. Along with this, somebody with type 2 dealing with a gluten sensitivity or allergy will likely be malabsorbing nutrients, so their body is actually undernourished but overfed most of the time. It can also cause some gastroenterologist or enterology problems with your digestion. So I don't seem to have an issue with gluten because I eat complex carbohydrates that sometimes are wheat, oats, etc. Gluten free diets sometimes will be lower in carbohydrates, which will actually help with your blood sugar management. However, you've got to be careful. Just because something's gluten free does not mean it's a health food or a healthy food for you. You've got to watch it. They use every little thing they can as buzzwords, like sugar free when it's got 10 grams of sugar alcohol in it. And you want some gastrointestinal issues, take in lots of sugar alcohol, and you'll see what I mean. Whole grains. Now, a lot of your keto people don't believe in any grains, any fiber, anything other than like meat and protein. But whole grains, even for people with type 2, as long as they're specific ones and they don't initiate a trigger in you, and you've got to watch everything. You've got to keep an eye on stuff. Everybody's an individual. You're responsible for yourself. All you do here is get information. What you do with it is up to you. But the grains and the ones I'm talking about are like your whole grain spaghetti and pasta products, your oats, your old fashioned rolled oats, not quick oats, not flavored packets, nothing like that garbage. Obviously, you can also get a lot of fiber from vegetables, so that's a questionable argument. Also, going gluten free because it does you have a tendency to cut down on processed and high calorie foods. It often accompanies or is accompanied by a weight loss as well. So you're getting a little healthier and dropping some weight. Not a bad deal. Another issue is nutritional balance. If you're dealing with both these issues, it's going to be extremely difficult to get things right. You really should consider seeking help of a professional nutritionist, dietitian, somebody like that. Okay, continuing along with, okay, type 2's diabetes comes with its own set of challenges from managing blood sugar levels to making healthy dietary choices. But for some individuals with type 2 diabetes, there's an additional complication with gluten allergies. Having both type 2 diabetes and a gluten allergy can be a real trick to deal with. As I said before, get a nutritionist, get an expert involved, create a meal plan, and follow it. And keep track of your gluten, your blood sugar, etc. Remember, we track. We like to track things, to not just out of paranoia, but to watch for progress. Gluten is a protein that's found in wheat, barley, and rye grains. So if you know you've got a gluten issue, stay away from those particular grains. Another issue is even if it's oats that don't have gluten, if they are grown within a relatively nearby field of wheat, the winds can carry over some of the pollen and cause issues there with gluten. Consuming gluten leads to inflammation of the small intestine and multiple symptoms, including digestive issues, fatigue, and skin problems, breakouts, and the like. How does gluten affect individuals with type 2 diabetes? When someone with type 2 diabetes also has a gluten allergy, the effects can be more exacerbated, higher inflammation, and insulin resistance, making it ever harder to manage the blood sugar, which is a primary goal. Managing a gluten allergy on top of type 2 diabetes requires careful planning and attention to detail. It means scrutinizing food labels, avoiding cross contamination, remember the wheat and the oat fields, and finding alternative gluten free foods. Okay, that's all I'm going to hit you with on gluten and type 2. Up next. Okay, now we officially launch the overly complicated multi-polysyllabic word of the post, or just the overly complicated multi-polysyllabic word. This is bizarre terminology and vocabulary of medical and nutritional and sometimes scientific basis that we have to use because of what we do and who we are. So, our first one, and I'm actually going to be able to pronounce this one. We'll get to some of them where the outtakes for my mispronunciations alone should be pretty interesting. This one is polysaccharides, something that is vital to your body's overall functioning, but you're probably not even aware of it. It is a complex group of molecules composed of long chain sugars. These sugars are joined together through glycosidic bonds, forming complex carbohydrates. Sources of polysaccharides are primarily plant based foods, including grains, legumes, tubers, and the starch from polysaccharides serves as a quick energy source, a reserve empty. It also involves cellulose, which is components of plant walls that are not digestible by humans, but they add filling fiber to the diet, thereby filling up your hunger pain and filling it with a combination of fiber and water and moving you along your way to stay away from junk foods. Glycogen. This is this serves as a storage form of glucose, and it is primarily stored in the liver and the muscle tissues. There's something else listed called chitin, which is a material in the exoskeletons of arthropods such as insects and crustaceans that I ain't even touching. I ain't talking about it. Health benefits of polysaccharides. Well, you can get a lot of fiber, such as cellulose and hemicellulose, which both promote digestive health. and support the growth of beneficial gut bacteria. Now, there's arguments going on whether health starts in the mouth or in the gut. Why not play it safe and run with both? Blood sugar management. Resistant starch has been shown to help regulate blood sugar. Immune support. Medicinal mushrooms have immunomodulatory properties and may help enhance the body's immune system. Hey, I'm not going to get all these right. I didn't realize they had that one snuck in there. And skin health. Hyaluronic acid found in connective tissues and skin. This helps maintain hydration, elasticity, and integrity. In conclusion, polysaccharides support digestive health and blood sugar management, help with the growth of the immune system, and in care for the skin as well. Got to get some of these things in you. Where can you get them? Well, I'll tell you right now. In whole grains such as barley, oats, brown rice, quinoa, whole wheat, legumes such as beans, lentils, chickpeas, fruits, apples, oranges, berries, bananas, pears, vegetables, broccoli, carrots, Brussels sprouts, spinach, kale, and sweet potatoes, root vegetables like potatoes, yams, and beets, whole grain products, whole grain bread, pasta, and cereal, nuts and seeds, which are rich in fiber, phytonutrients, just all kinds of great benefits. Look to almonds, walnuts, chia seeds, and flax seeds. And if you've got any prostate issues, consider pumpkin seeds as well. Medicinal mushrooms, shiitake, maitake, reishi, and lion's mane, contain beta glucans, which are immune boosting properties. Seaweed, nori, kombu, wakame have various health benefits. Once again, the psyllium husk, it provides fiber that doesn't get digested. It's non-caloric. It just simply fills space temporarily so you don't fill it with something worse. Mucopolysaccharides are complex molecules involved in supporting joint health all the way to maintaining skin elasticity. Okay, they're going to get me another time with one of these trick words. Glycosaminoglycans are long chains of sugar molecules that are vital components of connective tissues, made up of repeating disaccharide units found in cartilage, tendons, ligaments, skin, and the fluid that lubricates joints, which I believe is synovial fluid. Functions of mucopolysaccharides. Joint health. They help to maintain the health and integrity of joints, providing cushioning and lubrication. Reduce friction, prevent wear and tear on cartilage. Skin elasticity. Contribute to the structure and elasticity of the skin by maintaining hydration levels. Supporting the formation of collagen and elastin fibers. Mucopolysaccharides are also good for eye health. Found in the vitreous humor, a gel-like substance that fills the space between the lens and the retina. Vitreous humor. I'll bet you didn't know that. Wound healing. It helps promoting tissue to regenerate and repair. Very vital. Cardiovascular health. Some have anticoagulant properties, prevent blood clots, and maintain healthy blood flow, thereby reducing the risk of thrombosis. supports joint mobility and flexibility, promotes healthy, radiant skin, helps to maintain clear vision and eye health, facilitates the healing of wounds and injuries, contributes to overall cardiovascular blood circulation. Now, do you see how much a category of superfoods can give you that's beneficial compared to the junk foods that give you toxins and start breaking down your body while you're in process of consuming them? Think about it. You want to run with the superfoods. You want to adapt that lifestyle. If you're dealing with type 2 diabetes, you want to figure out how to go ahead and fix it. Or you can stay on drugs forever. Supplementation: glucosamine, chondroitin sulfate, hyaluronic acid, all support joint health, skin elasticity, and overall wellness. Okay, that's it for today's lesson. Have a good day, and we will be back soon with another overly complicated multi-polysyllabic word. Thank you. Okay, another entry into the overly complicated multi-polysyllabic word. This is one you've likely heard of, perhaps seen on labels, or even heard it being talked about, but you may or may not know all that much about it. Well, after this post, you will know a little bit more, or maybe a lot more, about Trolox equivalents. Part of the antioxidants and their beneficial effects on health, the term Trolox equivalents often emerges in scientific literature and discussions, but what are they? Why are they important? Trolox equivalence is a unit of measurement used to quantify the antioxidant capacity of a substance in comparison to Trolox. Now, what the hell is Trolox? Trolox is a synthetic, water-soluble derivative of vitamin E. Why is this important? Because vitamin E is an oil, and if you can dilute something with water, you can increase and expand testing procedures considerably much more rapidly. So they created what they consider to be a exact duplicate, but it's water soluble. Trolox equivalent antioxidant capacity, TEAC, is a method used to determine the antioxidant capacity of compounds or biological samples. The ability to neutralize free radicals or reactive oxygen species, antioxidant potency related to Trolox. So Trolox is basically ground zero, and if something has a negative Trolox reading, that means that you're going downhill, and depending on how further up it goes, that you're getting into much healthier, much more superfood-like categories. Trolox equivalents are vital to research, specifically in antioxidants. Researchers can access their potential to combat oxidative stress and try to use more natural substances rather than medicines to treat conditions with. Understanding the antioxidant capacity of food, supplements, and pharmaceutical compounds can inform dietary recommendations, product formulations, and treatment strategies. Foods rich in antioxidants such as fruits, vegetables, nuts may have a higher Trolox equivalent value, indicating greater antioxidant potency. Remember to like, share, subscribe, make a comment. I'd like to hear from somebody. So that was another post of the overly complicated multi-polysyllabic word. So far, I've been able to pronounce all of them. This will change over time. This is Robert Lee signing out. I hope you're doing well. I hope you're gearing up to take some online courses before the big one presents itself. Thank you. Have a great day.